Ethiopia is one of the poorest countries in the world, but over the last decade, it's dramatically reduced its rate of childhood mortality. The country's health extension workers are a large part of the reason why. I recently had a chance to have coffee with some health workers I met during my first visit to Ethiopia in 2012. Yida Gesu and Betula are two of Ethiopia's 38,000 health extension workers working to improve healthcare in the remotest regions of the country. It's very impressive, and I'm very anxious to get an update on what you think is going well and what's not. But the fact that the child mortality rate is down so dramatically, that's an amazing achievement. The number of children who are living now it's fantastic to see that. So at least a lot of it's working well. Well, it's great that Ethiopia is so stable and so focused on investing in health and agriculture and really trying to uplift itself. I'm quite optimistic that the kind of growth rate, which has been very high, will continue. The government has a plan to by 2030 to move up into that middle income category. So if everything goes well, which the last decade it certainly has, there'll be a lot of change here. They're working to create new jobs, building up the universities. So I think Addis is going to keep changing a lot. Unlike the city, in the rural areas there are no doctors or hospitals nearby. Health extension workers start with a 10th grade education and are given an extra year of training in basic health services like antenatal care, postnatal care, immunizations, and family planning. At remote health posts, they do checkups and care for the women and children in the villages. They gather health data on all their patients, and they have large wall charts where they track births, immunizations, and other vital information. They travel the countryside on foot, sometimes covering up to 10 miles a day. When they do home visits, they take measurements to see that newborns are staying healthy and answer questions mothers have about how to care for their children. They also provide critical care for women who are pregnant and encourage them to give birth at the health center where they can receive the support they need. Back in 1990, 1 in 5 children died before age 5 in Ethiopia. But thanks to this health worker program, the country's child mortality rate has fallen by more than 60%. It's exciting to see how many children owe their lives to the health workers like Yida Gesu and Betula. Their work makes me optimistic about the future of Ethiopia. And now, other countries in Africa are looking to Ethiopia to learn from their success. It's just a great thing to see.